has evolved over the years, and medical breakthroughs occur every day that help extend the quality and meaning of the lives of patients and their families seeking treatment for cancer and blood disorders. In the United States, more than 1.6 million people are diagnosed with cancer each year. 600,000 people die from cancer each year, making it the second leading cause of death behind heart disease. During this episode of Banner Health's Making the Rounds, we are going to be discussing the evolution of cancer care, how treatment has progressed over the years, and the partnership Banner Health and MD Anderson have shared over the past decade. If you are new to our podcast, thank you for tuning in. And if you are a regular listener, welcome back. For today's episode, I am your guest host, Kathy Kuhlenbeck. With me today is Peter Fine, Chief Executive Officer of Banner Health, and Dr. Rogerio Lilenbaum, Senior Physician Executive for Oncology, Banner MD Anderson, and Banner Health. Welcome, gentlemen, and welcome to the program.
Thanks for having us.
Thank you.
Great. Let's start with you, Dr. Lilenbaum. Share with us how cancer care has changed from its early days to where we are now.
Thank you, Kathy. Cancer care has evolved significantly over the past decades. We came from a poor understanding of the mechanisms of cancer to now being able to determine at a molecular level how cancer develops in a tissue or an organ. And among many of these discoveries, scientists have been able to identify drivers or driver mutations that lead to the development of cancer in a specific organ. Importantly for this conversation today, many of these driver mutations, or so-called targets, are susceptible to drugs. And so we now have the ability, beyond the crude tool that chemotherapy was, to identify a specific target in the cancer cell and then block that target with a specific inhibitor. And when that happens, the cancer stops growing. And it's an important development that, in fact, started with a form of chronic leukemia and has now expanded to a variety of solid tumors. Most recently, we've seen the advent of immunotherapy. So after many attempts to harness the immune system to attack cancer, we now have a group of drugs, so-called checkpoint inhibitors, that are able to unleash the immune system to, one, recognize, and second, to attack cancer cells. And what's incredible about this development is that once the immune system is activated, it doesn't really work like chemo, which you need to keep doing in order to maintain the cancer under control. The immune system is activated, and even if you stop the drug, the immune system will continue to keep that cancer under control. It's an incredible development. It's been in the making for several decades. We're now able to utilize this tool in almost every solid tumor, and also in some malignancies in the blood. So a lot has happened in cancer care in the past few decades.
Thank you, Rogerio. Given this significant evolution in cancer care, what do you believe sets MD Anderson apart from other cancer programs?
Banner MD Anderson is a partnership between two formidable organizations. We are in a unique position to leverage the scale and the impact that Banner Health has had in healthcare in the Southwest of the United States, and at the same time leverage the expertise of the #1 cancer center in the world. We stand for 4 pillars. One is excellence in clinical care, which includes, by definition, access to clinical trials and clinical research. We focus on operational excellence and patient-centered care. Everything we do, everything we design, every initiative, every project has the patient at its center. Because of our size and our system-wide presence, we want to make sure that Sophia walks into every one of those sites and has a similar experience. So we work hard in trying to make that experience the same. And we integrate all of these sites, combining some central aspects with some local regional aspects of care. And then we wouldn't be able to do any of this if it wasn't for the people that we have within Banner MD Anderson. Their passion, their commitment, their expertise, their dedication, their will to change people's lives is what drives Banner MD Anderson towards excellence.
Thank you, Dr. Lilenbaum. We greatly appreciate your expertise and passion for cancer care and level of commitment Banner Health and MD Anderson have for our patients and their families. Peter, Banner Health has always been on the cutting edge of healthcare at every level since it first came into existence in 1999. Can you tell us what inspired you to seek out a partnership with the world's leader in cancer care and how you envisioned the delivery of that care to our patients in Arizona and Colorado?
Sure, I'd be happy to, Kathy. So if you go back a little ways to 2006, we began to assess the cancer care products in our marketplaces at the directive of our board of directors. The board was looking to try to identify a product that was more inclusive and not disjointed. And at that point in time, cancer care, certainly in our Arizona market, was very disjointed from a patient's point of view. So together we determined that we needed some new approaches to providing care. This led to a countrywide search, and I do mean countrywide, to try and identify a mutually beneficial partnership with an organization that had a degree of expertise that we didn't feel we had at the time. We consulted with various centers about both their clinical capabilities and their cultural fit with us, and determined that the right partner was MD Anderson Cancer Center. And we looked at a dozen or more of these major cancer centers. This decision was really based on our own analysis, and it was supported by independent rating systems validating MD Anderson was not only the largest cancer center in the country, covering the most subspecialty areas with significant clinical trial capabilities, but the degree of quality that came out of that organization was really a great attractor for us. An added benefit was that we could build our workforce pipeline via residencies and fellowships and hopefully be able to recruit out of the MD Anderson graduate medical education program to be able to find future physicians to staff this growing cancer center we were building. We had never done a partnership to this extent other than possibly in laboratory medicine with Quest Diagnostics, but we felt this relationship would allow us to build an oncology capability that we believed didn't exist for the communities that we served and help build our own growing reputation in Arizona as well. So we developed an agreement that put the primary responsibility of running the business on Banner and the primary responsibility for the clinical side of the business, things like recruiting the staff, training staff, integration of clinical research, on the back of the MD Anderson partner in this agreement. It's important to note that this partnership is not about and never has been about branding. We're not buying a name and they're not selling a name. It's an alignment to values and serving our patient population. These things take time, and between 2006 and 2008, we both did our due diligence, and we signed an agreement in the spring of 2009. The first building that we built, construction began in 2010, and we opened the Banner MD Anderson Cancer Center in Gilbert on September 26, 2011. That first building was about 133,000 square feet. We then proceeded to add another 100,000 plus square feet in 2014, bringing the total cancer center space from an outpatient perspective to about 236,000 square feet. And now we've got an expansion project underway at the Banner Gateway Medical Center which sits right next door to the outpatient buildings of the cancer center. They'll add 311,000 square foot patient tower, which will nearly double the size of the hospital, but primarily being accomplished to accommodate the growing cancer program, both from an inpatient perspective and a surgical perspective. Over this time now, we've grown from 20 physicians in 2011 when we started to more than 140 oncology specialists in 2022. And we've also added 100 advanced practice providers as well. Our programs have treated more than 131,000 patients in Arizona and over 20,000 in Colorado, representing more than 1 million patient visits to our facilities.
What was the most challenging aspect of bringing Banner and MD Anderson together as partners?
Well, the most challenging aspect of the relationship and subsequent growth was recruiting the right staff to build our desired culture, whether that was nursing, pharmacy, or other clinical support areas. And a new endeavor like this requires a growing mindset and willingness, quite frankly, to be flexible. So this meant freedom from Houston for the model to develop and flourish, and a strong desire from Banner to grow outside of our norms. There were some fits and starts in the early stages that you would expect with any new program, but we recognized the need to bring in different people and assess the speed at which we can sustainably grow. And for those that were joining us, there was some risk, as this was a new approach for our market, and it was a program that had to be built from scratch. So with that comes people that are willing to be program builders, both on the physician side and the non-physician side.
Yeah. What was the most rewarding aspect of this partnership?
Well, I think the most rewarding aspect of the partnership is that we're able to give the public at large access to coordinated oncology care from one part of the spectrum to the next, whether that's surgical, medical, imaging, radiation. And it turns out we've served our patients pretty well, as many of them have become our biggest cheerleaders. We outgrew our first building and then our second building, and now the inpatient tower will provide even more multidisciplinary care. The expansion will also support a third ambulatory building that we've scoped out. Constant growth is really a factor of the customer base saying this is a good product and sharing that sentiment with their family and friends. But another unique and rewarding aspect of the relationship is the access to the Houston team and how that access directly benefits our patients. The seamless access to uniquely qualified super subspecialists in Houston, literally by text, email, or phone, means we're able to connect in near real time to MD Anderson's highly qualified clinical teams.
Thank you, Peter, for your commitment to this partnership and your desire to bring world-class cancer care to our patients. Gentlemen, in the few minutes that we have left, where do you see the future of this partnership from a physician perspective as well as from a CEO perspective? Dr. Lilenbaum, you first.
Thank you, Kathy. We will continue to focus on delivering expert-based, multidisciplinary, comprehensive, patient-centered care in all of our sites and locations. We continue to focus on talent acquisition, talent development, and retention. We continue to focus on operational excellence so that we can make life easier for our patients in a journey that is incredibly hard to begin with. So we want to facilitate in every aspect that is within our control, patients to go through the different levels of engagement and treatments and commitments that they have to overcome and survive their cancer. I want to make a point that in addition to the treatment capabilities that Banner MD Anderson continues to develop, we also have a special interest in early detection of cancer and screening of cancer. So we have highly capable individuals who work to detect cervical cancer, colon cancer, breast cancer, and now lung cancer at a stage in which that cancer is highly curable. It's important. Cancer was an uncommon disease before the 20th century. And my sense, if we keep evolving just as we have for the first 2 decades of this century is that by the time we get to the end of the 21st century, cancer will be uncommon again. And Banner MD Anderson will be part of this journey. We think that we have the best system for delivery of cancer care in the southwest of the United States. We will continue to leverage and harness all the capabilities that exist within Banner Health and the expertise that exists at MD Anderson in Houston to create this unique combination of patient-centered, integrated care at a level and scale that has not been seen in this region before.
Great. And last but certainly not least, Peter, your thoughts about the future.
Well, in the time we've had this open, the growth has been exponential and quite exciting. And exciting from the perspective that the customer base is growing the product and word of mouth is growing the product. We've expanded off the main campus in Gilbert and built a significant new outpatient capability downtown at the Banner University Medical Center Phoenix campus. We're adding similar capabilities and resources in the northwest part of the valley here in the greater Phoenix area. And we're looking for additional expansion sites geographically. This, of course, will ensure we can provide a product from a medical and radiation oncology perspective within the entire market that we serve. We've seen MD Anderson expand in this way successfully in Houston by putting clinical resources closer to where the patient is located. So while the patient may at times have to come and visit the main campus for diagnostic reasons, the model has been devised in a way that the patient can receive treatment associated with that diagnosis closer to their home, whether it's infusion, surgical, or radiation. It's a model that really aligns to our mission of making healthcare easier so life can be better.
Thank you both for taking the time to share your thoughts and comments on the evolution and partnership between our two progressive and our industry-leading organizations. I think we can all agree that this partnership offers our patients the best possible care when they need it and just around the corner from where they live and work. Thank you again and have a great day.
Thank you so much.